diagnosed with arthritis in the knee, I'd experienced rather loud clickings and crackings from the knee, which I ignored for a while. I thought, oh, it's just age, and it slowly swelled, and it got to a point where I could hardly bend the knee, so that was the time to go to the GP.
Osteoarthritis is a very common condition in the United Kingdom and tends to affect people over the age of 45. It can affect any joint in the body, but one of the most common joints that it can affect is the knee. Some of the common symptoms that you might find that you have are stiffness in the knee. You might not be able to bend or straighten it as far as you could before. It could also become quite weak in the muscles surrounding the knee, especially the big ones on your thigh, the quadriceps muscles, and this can on occasion lead to the knee giving way as you walk.
I thought that I might not be able to do the jobs that I do around the house and working in the garage, and maybe even finding it difficult to walk. And I think I'm able to deal with it a lot better now than I would have done had I have just sort of carried on and tried to ignore it.
Best advice to someone with arthritis is to pace themselves, to do a little bit of activity followed by a little bit of rest, and to try and keep that balance going throughout the day. To try and find some exercise that's you enjoy for yourself. So swimming is a really good one because it takes some of the weight off the joint. Walking, low impact sports like that can be really helpful as well. If you are a little bit overweight, then it's a good idea to try and lose some because that can reduce the stress on the knees.
It's common belief that you need an X-ray to diagnose osteoarthritis, but this isn't the case, especially in the less severe cases. Your diagnosis is more likely going to be made from how you feel and the symptoms that you're experiencing, and an X-ray isn't going to give us any more information that we don't already know.
Well, I went to hospital and them give me first injection, and afterward them say you want to do it operation. I say no, I don't want operation. Physio people decide you do it exercise. Well, sometimes it's painful, but the physio lady say if you pain, don't do it, stop. Them very good ladies.
The first exercise to do is to bend the knee all the way up and straighten it all the way out to maintain the mobility of the knee. Then do an exercise where tighten up the muscles on the front of the leg by pushing your knee down into the bed. The third exercise would be to put a rolled up towel or a small cushion underneath the knee so it's held in a bent position, and to straighten out the lower part of the leg. And then the last exercise would be again with the leg out straight, tighten up the thigh muscle again and lift the leg straight up off the bed.
I'm doing in the kitchen my work, washing, cleaning, cooking, everything. And even my husband, if I can't do it, then my husband helped me. If my knee is all right, then I go out. I'm really happy about that, and I can do some more now.
If you find it difficult walking up the stairs, it's good to use the handrails. Try and, as you're going up the stairs, lead with the good leg first, followed by your weaker leg. And then when you're coming down, if you lead with the weaker one and follow that with the good one, that makes it easier.
My arthritis was diagnosed 10 or 11 years ago. I had a really severe flare-up, as they call it, and I was in a terrible state because I thought I was going to be like that for the rest of my life. I went locally to see a physiotherapist at Warmley, and by the end of the 6 weeks I felt I'd really improved, and on my cycling I'd actually doubled on that, so I was pleased about that. And I do push myself, and I have tried my best to help myself, and I feel really good at the moment. And I know it flares up and you can't always predict how it's going to be, and maybe in another few months I might be worse again, but I feel as though I understand it a little bit more.
Being diagnosed with osteoarthritis doesn't mean that you need to worry too much. There are lots of people available to help you manage the condition if you need it, but The most important thing is to remember what you can do to help yourself with the help of others.
If you think you've got a problem, go see the GP, get it sorted.
Don't feel nervous. It's very, very friendly people, you know. You please go there.
Definitely has boosted my confidence. I'm not so frightened to do things now that I was before.
You can stay just as active as you are now. You can keep doing all your activities that you enjoy at the moment. And together with your physiotherapist, with your friends, with your family, you can manage this condition and get along just fine.